Welcome to this space dedicated to scientific dissemination, designed for specialists, general practitioners, students, and the public interested in health. We present an analysis of the study published in 2026 by Dr. Ernesto Roldan Valadez and his team, Disseminated Tuberculosis Masquerading as Malignancy in an Immunocompetent Middle-Aged Woman. We will explore how this infection simultaneously affected multiple organs, including the peritoneum, liver, and spine, representing a critical challenge by visually mimicking metastatic cancer in a patient with no prior risk factors. We will identify key findings regarding early biopsy as the definitive resource for an accurate diagnosis, the precision of CT and PET/CT in mapping the full extent of the disease, the success of multidisciplinary management and standard anti-tuberculous treatment in achieving the patient's full recovery. Join us as we discover how precision medicine and clinical vigilance allowed for the distinction between a curable infection and a devastating oncological diagnosis. Legal disclaimer: this material is for educational and scientific dissemination purposes only. Its goal is to democratize access to the knowledge generated in specialized academic publications. Due to the dynamic nature of medical science, the information presented reflects the data available at the time of the original article's publication and may be subject to subsequent updates. Not medical advice. Under no circumstances does the information presented constitute a medical recommendation. The graphic resources used are only a representation of the article presented and are not completely accurate to human anatomy. For more information, you may pause the video.
Welcome to The Explainer. Today we're jumping straight into a medical mystery where an ancient infection wore the absolute perfect disguise. We are looking at disseminated tuberculosis masquerading as malignancy. Now, just a quick note before we get into the investigation. This explainer is specifically intended for the dissemination of scientific knowledge. So whether you're a medical specialist, a general practitioner, a resident, a student, or just someone in the general public who loves a good medical puzzle, there's a profound lesson here for all of us. It's really about the limits of our technology and why we always have to look a little deeper. So what exactly happens when a deadly infection wears the perfect disguise? What do you do when a patient's symptoms literally lie to you? Imagine a bacterial infection deciding to behave exactly like an aggressive spreading cancer. I mean, it creates an absolute diagnostic nightmare, right? To understand how this happens, we're going to follow the clues exactly as the medical team experienced them. Let's start with the timeline of our patient. She's a 51-year-old immunocompetent woman. And let's really emphasize that word, immunocompetent. No HIV, no immunosuppressants. Her immune system was functionally totally normal. 6 months prior to being admitted to the hospital, she just starts feeling kind of unwell. Unexplained weight loss, some intermittent abdominal pain, low-grade fevers. Then 3 months later, things get much worse. Scans show masses in her pelvic region, and she develops this brand new back pain. Finally, on the day of admission, she has this abrupt, severe, burning pain in her lower spine that radiates all the way down her legs just from trying to stand up. When she arrived at the hospital, doctors immediately started running full-body scans to figure out what was causing this catastrophic pain. And what they found? Honestly, it was terrifying. The disease was everywhere. Think of it as a vast, overwhelming crime scene within her body. It was aggressively attacking her lower spine at the T11 and T12 vertebrae. It had invaded her kidneys and bladder, which was causing severe bleeding. It was in her adrenal glands, spreading across her peritoneum, that's the lining of the abdominal cavity, and her ovaries. It even reached structures right near her liver. Now, looking at this massive multi-system spread, the medical investigators immediately locked onto one terrifying prime suspect: advanced metastatic malignancy. Think about it. If you're a doctor looking at a perfectly healthy 51-year-old woman whose body is suddenly just riddled with lesions across her spine, her abdomen, her reproductive organs, your brain instantly anchors to one conclusion: cancer. Specifically, late-stage metastatic cancer that's broken out of its original location and seeded itself all over the bloodstream. Statistically speaking, it's just the most logical explanation for this level of widespread destruction. But here is where biology gets incredibly clever. This is where the disease acts like a true chameleon. Disseminated tuberculosis can perfectly mimic widespread cancer. It spreads through the blood to non-adjacent organs, completely tricking those initial clinical impressions. We usually think of tuberculosis as a localized lung infection, right? But in rare cases, even in completely healthy adults, the mycobacterium breaks through the body's defenses. It enters the bloodstream or the lymphatic system and seeds itself into multiple organs simultaneously. This is disseminated tuberculosis. And didactically speaking, it causes the exact same weight loss, the exact same multi-organ inflammatory masses, and the exact same highly active metabolic hotspots that cancer does. To solve this mystery, the doctors used advanced imaging as their navigator. In modern medicine, we rely heavily on this navigator. CT scans, MRIs, PET scans, they're absolute marvels of technology, giving us a high-definition roadmap of exactly where the body is under attack. But we really have to remember their fundamental limitation. They map out the destruction, sure, but they cannot interrogate the criminal. They can't tell you with absolute certainty what is causing the damage, only that the damage is happening. So let's look at how these scans meticulously charted that destruction. The MRI of her spine showed spondylodiscitis. That's severe inflammation of the vertebrae and discs, and it was pushing right into her spinal canal, causing a massive 60% narrowing. That is what was causing that agonizing leg pain. Her spinal cord was literally being crushed. Then, the CT scan of her urinary tract showed lesions just chewing into her kidneys and enlarging her adrenal glands. And the PET CT scan? Well, PET scans light up when cells are consuming high amounts of glucose. Hers showed bright, hypermetabolic nodules in her lungs, adrenals, and thyroid. Now, cancer cells consume a ton of glucose, which is why doctors use PET scans to find tumors. But guess what else consumes a massive amount of glucose? White blood cells violently fighting off a severe tuberculosis infection. Because the navigator can be fooled by the chameleon, the medical team had to call in the Arbiter. That's a direct tissue biopsy to hand down the final verdict. You just can't start a patient on aggressive chemotherapy based solely on the navigator when there's even a sliver of doubt. You have to go in, physically extract a piece of the battlefield, and look at it under a microscope. You absolutely need the Arbiter, histopathological examination. And wow, did the Arbiter unmask the impostor? It wasn't cancer at all. It was a severe, disseminated case of tuberculosis. When the surgeons went in, they didn't find malignant tumor cells. Instead, under the microscope, the pathologist saw necrotizing granulomatous inflammation. This is a highly specific pattern where your immune cells form a wall around an invader, and the center of that wall basically dies and turns into a cheese-like substance. It is the absolute classic textbook hallmark of TB. And to put the final nail in the coffin, a highly sensitive PCR test on her urine definitively detected the actual DNA of the bacteria, Mycobacterium tuberculosis. Once the impostor was unmasked, a multidisciplinary team coordinated a really swift, aggressive attack. First, surgical stabilization for her spine and bladder, followed immediately by the gold standard, highly effective HRZE intensive drug regimen. This was not a one-doctor job anymore. The neurosurgeons had to immediately operate to decompress her spinal cord and literally rebuild her vertebrae with hardware so she wouldn't be paralyzed. Urologists had to go into her bladder to evacuate massive blood clots from the kidney bleeding, and simultaneously, infectious disease specialists hit the bacteria with a 4-drug cocktail known as HRZE, isoniazid, rifampin, pyrazanide, and ethambutol. After just weeks of this intensive phase, the lesions began to shrink, she started gaining weight, the severe morbidity was actively reversing. Incredible, right? So let's review why this all matters. If you take anything away from this explainer, let it be these key clinical takeaways. First, you have to maintain a high index of suspicion. Do not assume TB only happens to people with weakened immune systems. It can strike fully immunocompetent adults totally out of nowhere. Second, no matter how advanced our PET and CT scans get, they map activity, not identity. They cannot definitively separate an aggressive infection from cancer. Imaging has to be used to guide targeted biopsies, but the histopathology is strictly decisive for an accurate diagnosis. And finally, getting that tissue diagnosis right is quite literally a matter of life and death, because early standard treatment successfully reverses even the most severe morbidity. It really leaves us with a critical reminder, doesn't it? Never take the disguise at face value, and always look deeper when solving a medical mystery. In a world where we can look inside the human body with stunning digital clarity, we have to remember that biology is infinitely clever. Symptoms will lie to us, scans will be tricked. It's the vigilance of the human mind, questioning the obvious, seeking the tissue, relying on multidisciplinary teamwork that ultimately unmasks the truth and saves the patient. Thanks for joining me on this incredible deep dive, and I'll catch you on the next explainer.
The reference for the article from which this information was extracted is displayed on the screen. Thank you very much for your attention and for joining us until the end of this analysis. If you found this review helpful, we invite you to share it with colleagues, residents, students, and anyone interested in these topics. Don't forget to subscribe and turn on notifications. This material is for educational and scientific dissemination purposes only.